encapsulate on the RHA or HintMD launches? Just trying to understand more of those launches, maybe any additional metrics. For example, is HintMD kind of tied to DAXI, where potentially we could see an incremental step up when DAXI is approved later? Thanks.
Great question. So we'll try and capture all of them here. So first one on DAXI and sort of feedback that you've heard from the field in terms of willingness to try the product. We've not given out specific pricing information at this time, but what we have talked about is based on our market research and because of the hundreds of millions of dollars that we've invested, that we would expect this to be a premium priced neuromodulator because of the duration profile. And that in the discussions that we've had with physicians, we believe that they'll be able to charge more as well, and that consumers will pay more, and then we should get more as a reward for the innovation. If you look at a lot of the market data out there, average consumers for neuromodulators only come in about twice a year as it is, which means that based on the duration profile of existing neuromodulators, they end up in a zone of under treatment for a period of time. So we actually think that with a product with this duration profile, physicians will be able to charge more. Patients will come in, probably at a frequency level that's consistent with what they do today. And so everybody wins. The patient pays a little more, but gets, longer duration of the effect that they're paying to come in for. Physicians make more per visit, and we do well as a manufacturer for driving innovation. Again, we're looking to segment the market. I don't expect that in an account they'll switch everything out, but we believe that there's a healthy part of the market that will opt into sort of this prestige or premium product offering, and we think they coexist. If you look at a lot of accounts today, they will end up with more than one neuromodulator on the shelf. They'll have, one or two different fillers on the shelf, and so they will offer the products that they think resonate the most with consumers. And so we think this sort of premium or prestige strategy resonates really well and aligns with our market data. And we'll obviously give out the pricing information as we get into the launch cycle, but we do think that there's a premium for everybody. In terms of the CD side of things and what's gating the timing there, we talked about completion of our enrollment in the open label study in August of this past year. We now need to complete all the follow-ups. We then have to have the end of phase 3 meeting with the FDA. We've talked about a submission in 2022 and then an approval in 2023. So that's just basically driven by completing the trial, wrapping up the data, meeting with the agency, and so that's kind of how we get to that timeline. On the PF and sort of some of the changes that we make, as you referenced, this is our second phase 2 PF study. In the first PF study that we ran, we again saw really good pain reduction with both treatment groups, but we saw a surprisingly high placebo response rate. So the changes that we made were designed to try and better separate out placebo from treatment. Again, in this phase 2 study, we showed really good pain reduction in both treatment arms, but also, again, an unusually high placebo response rate. And so we had done a variety of things. Before we injected both the calf and the heel, so we went to just the heel because the calf can be a trigger point release for dry needling, and we thought maybe we could do that. We changed the way that, the inclusion criteria to make sure that we were capturing those with true plantar fasciitis pain. Rather than just measuring one single point in time for the pain measurement, we did it over the course of 5 days so that we tried to make sure that we captured it. Unfortunately, despite the changes that we made with really good input from a lot of clinicians out there and insight, we again ended up with a really high placebo response rate. So we're disappointed that the product performed well, showed a really good safety profile as well. But I think that as we've gone back and we've sort of reflected on things, plantar fasciitis is a very different physiology. It's inflammation of the plantar fascia. It's secondary to injury. There's a lot of other things going on. And if we look at our other programs in muscle movement and, existing indications for pain, those are categories which are much better characterized, and the performance of neuromodulators in those categories makes sense. And, for us right now, the thing that we've demonstrated in 2 phase 3 trials is an encouraging duration profile. So I think focusing on those indications that are known where our product profile has an opportunity to be very competitive is a more judicious investment of our resources and time. We will, to your point, do some additional subset analysis, see if there's other things that we can glean from it. But I think with where we are today, we're again going to focus more on kind of the muscle movement and existing indications as sort of our primary focus. And then the last one that you had was on the RHA and HintMD and, combination of the two. I mean, it's early right now. We took two disparate organizations, put them together. We think we've done a great job of distilling down the message, making sure that we can get leverage where possible. We're early in that. We think that the products that we're introducing into the market fit very well with the discussion around services that can help the practices and vice versa. So while it's early, we do believe that there will be some pretty good synergies that we can unlock as we move forward and we link the two together. But it's still early, and I think more to come as we move forward.
Your next question comes from the line